Welcome to the CR Arthritis event 2025. My name is Ellen and I'm the programs coordinator at Arthritis Consumer Experts. Today I'm joined by Dr. Alaa, who will be presenting on clinical pearls and mysterious cases. Dr. Alaa is a fellow at SickKids The Hospital in Toronto, and before she became a fellow at SickKids Hospital, she was staff and educator in Kuwait for the pediatric residency program. So she brings with her a lot of knowledge, and I'm very excited to learn from her today. So welcome to our program. Thank you so much for joining us.
Thank you for the introduction, and thank you for interviewing me, actually.
It's always a pleasure. And let's start by asking, is there anything else you would like to share with us about yourself and how you're involved in rheumatology?
So you did a nice introduction, actually, and currently I'm a fellow in systemic autoinflammatory diseases at Kuwait Hospital, University of Toronto, and I completed my medical education in Kuwait, and then my pediatric residency as well in Kuwait, and then I joined the rheumatology core fellow here in SickKids of 2 years that we've done, and then after that I did continue my education in systemic autoinflammation, and now I'm currently finishing the second year of that fellowship.
It's truly an incredible process, incredibly rigorous. And thank you for dedicating so much of your life to that. I'm so excited to hear about some of these clinical pearls and the mysterious cases presentation. Could you share with us, let's start with, what is a case? When we say in health research, I'm presenting a case, what does that mean? Let's start there.
So usually if you want to present a case, it should be something interesting, not necessarily to be rare, but sometimes things that you don't think about it, or you need to be thinking out of the box, let's say. And some of the cases to be rare, or maybe a common, but with a rare presentation. So these are usually the cases that we presented.
Excellent. So what I'm understanding is, these are individuals, or maybe inspired by some of your lived experiences working with individuals with inflammatory arthritis, that are a little bit unique and maybe out of the box, we can say.
Yeah.
Excellent. And what does this mean for individuals living with arthritis? Could you maybe share with us one of these cases?
Yeah. So to be honest, my specific case, it's not involved to have an arthritis, but it do have because it's an autoimmune disease, which is a very rare disease. It's have an overall inflammation in the body that can make the patient really fatigue and in pain, and generalized pain, and maybe joint pain, not specifically to be swollen or arthritis. But of course, the umbrella of having autoimmune disease in general does have associated with other inflammatory arthritis in their patient's presentation. So,
yeah, it is so interesting, I think, and maybe you can speak to this as a rheumatologist, that it is one of the areas in medicine where no one presents the same. And we think of, we give these labels like, you have rheumatoid arthritis, you have lupus, you have axial spondylitis. But what we're trying to do is we're trying to understand and put people in broad categories so that we can provide medications and education and treatment. There's so many of these, like you said, these cases that there is something systemic. Is it arthritis specific? That's arguable under the definition of arthritis.
yeah.
Can I ask, how many of these unique cases do you see in when you work with patients? Would you say the majority of individuals fit nicely into a category or a label or a diagnosis, or are these cases more common than we think?
To be honest, it's rare, and it's not that common. So you may encounter one case in your life, or you may not. So especially with the subspecialty of being autoinflamed, diseases, these are really rare cases that we encounter in our life. But yeah, if it is there, someone have to suspecting it because it's not only like joint pain or maybe joint swelling. It's mainly a generalized pain in the body with generalized inflammation and have a lot of severe scale affects the patient's health.
It is, like you said, like very much so systemic, very much so not localized to a single joint. I do think it's like very interesting. Like you said, it is very rare. Um, but myself in going through physio school right now, we always check for red flags. We always check for CV stability, right? Cranial vertebral stability. Even though we are told like you may see one case in your entire life, it's still super important as healthcare professionals that we know what these rare cases are. So when we do see them, we don't miss them.
Yeah.
Incredible. So this year's meeting's theme is Ascending to New Heights, Peaks of Innovation in Rheumatology, and it celebrates some of the latest advancements, some of the latest breakthroughs in the field of rheumatology. What are some of the latest innovations that you are personally looking forward to implementing in your field of work?
Yeah. So nice question, actually. I can definitely highlight some of most exciting innovations in rheumatology that are shaping maybe the future patient care. One of them is what's commonly being used is targeted biologic therapy. So biologic now widely are used, and that specifically target pathways in the immune system have already like revolutionized the treatments of inflammatory arthritis. And the neurobiologics are focusing on more precise molecular targets like JAK inhibitors, IL-6, or IL-1. Other things that I wish to look for it in the future, which is looking forward for gene therapy and RNA-based treatments, like advances in the gene editing hold the potential of how autoimmune and autoinflammatory disease like arthritis being targeted. And this could be involved in editing immune system, maybe related to gene, or prevent the overactivity of the immune response and maybe make it a balance. And that could be like, I think it's one of the hot areas of researchers nowadays. The other things that it's also been like studied a lot, which is the precise medicine and biomarkers, to continue gain momentum in rheumatology, allowing for more individualized treatment plan by identifying specific biomarkers that predict how patients will respond to certain drugs and how they will not. Yeah, for now, these are the things that I'm really looking forward to.
And well said. I think biologics is something we cover a lot on the program. And when biologics first came out, they revolutionized the field, and they can continue to do so. I think when we talk about biologics and the fact that we continue talking about them is because they're still improving, right? We're still doing a better job with the new generations of biologics.
I think we still need a lot to understand how it works, actually.
Yes, absolutely. Absolutely. Continued research on how it works, side effects, ways to mitigate those side effects. But I definitely want to touch on the second topic that you had spoken about, this concept of gene therapy for I guess, inflammatory arthritis. Still relatively new. Am I wrong in that? Am I correct in that?
Yeah, it's still like an area of like, let's say, under the microscope. So we know for definitely that there is a gene involvement. It's not specifically to be a monogenic for each disease, but there is like a gene contributes to the disease manifestation, especially in rheumatology disease and autoimmune or autoinflammatory. So there's a lot of research of studying how these like molecules and genes contribute in making these kind of inflammation or autoimmunity in the body, and maybe the future plan, like how to target specifically these kind of genes and maybe block it or remodulate it so we can like control it and then control the disease itself.
Yeah, it's so incredible to think like rheumatology is not only is there genes,
Right.
right?
Not only joints.
Yeah, not only joints. There's like so much involved. It's like systemic, and we know that it's encoded in our genes, right? That some of us may be predisposed, but we also know that there's environmental triggers like pesticides, sunlight, that we're still doing research on because we don't really understand. Like, yeah, it's such a unique field to be in. I love the complexity, and these innovations are really just so exciting. Amazing. And in your opinion, Dr. Alaa, what are some of the keys for successful implementation or putting these advancements into practice? How do we get there? Like, for example, like you said with gene therapy, still very much under a microscope, but like how do we progress this field so that maybe 10, 20 years from now, that it is an option?
Yeah, so implementing the latest advancements in rheumatology into clinical practice requires a lot of careful planning, collaborations, and like adaptability. So, like in clinical education and training, health professional training should be like ongoing and like every moment. It's not something that you have a degree and that's it. And something else like the cross-disciplinary collaboration, so multidisciplinary team ensure that all aspects of patient condition are addressed with cutting edge technology. So it's not only about the rheumatologist, maybe these cases are really complex and complicated by like immune deficiencies or immunology. Service should be there, maybe like weird type of skin involvement, dermatology should be on board, genetic also, and yeah, so these are like kind of people whose hand to hand works in the multidisciplinary team with rheumatology cases. And then the most important things what I think is the patient involvement. So patients should be actively involved in their care plan, understanding the latest treatment options and their benefits, empowering patients to make informed decision increases the treatment adherence and outcomes. Because if you're really not in the same line with the patient, they won't take the medication at the end or they won't listen to what you are saying. um, this is what I think that's really important for.
Well said, well said. And a huge part of ACE's work is in self-advocacy, is in shared decision making. So you hit the nail right on the head. I would fully agree with that. And to close, do you have any insights to share to improve a patient's disease journey, their self-care, or self-advocacy for patients who may, be kind of in between medications currently, who are having a little bit of a harder time adapting to the new lifestyle?
So improving patients' journey in managing their disease, especially in chronic conditions like arthritis, requires a multi-phases approach that empowers the patient themselves. By fostering medications, provide resources, encouraging regular checkups, supporting emotional health and social support for sure, advocating for proactive care. Patients are more likely to feel empowered and engaged in managing their condition, and a strong sense of control over their health and treatment plan can really improve the outcome and quality of their life.
Beautifully put. Yes. We all, need more than medications. As incredible as
Exactly.
gene therapy and
Exactly.
biologics are,
Yeah.
support from friends and family,
Because I
emotional.
know most of us like focusing more on the treatment and the treatment plan and the medication and blah 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 blah, but nobody is really looking for what patients like emotions, how they really, because they really understand that they are sick, that they really um, feel that they need the medication. They will adhere to it. What's behind that screen is, you know, you don't know what's the background of those patients socially and support and like financial support or yeah.
It is, like you said, like there's so much to understand when someone is diagnosed, and that's why we call it a journey, because it isn't just you take medication, you get better. It's really about looking at the picture holistically. Absolutely. Lots for us to think about. And I hope, like you said, there isn't very much research in the area. So Dr. Alaa, maybe in future, you and your colleagues will be tackling this area.
Maybe, hopefully.
Maybe. I'm sure you have many projects planned for future. But with that, I'd really like to thank you for your time, for your expertise, and for sharing with us some of these clinical pearls, as well as insights into how we can really navigate our healthcare journey. So thank you so much, Dr. Alaa.
Okay.
And with that, I'm going to thank the audience for joining us, and I hope you guys will tune in for the next episode as we venture into more of CR Arthritis 2025 with our interviews with incredible fellows like Dr. Alaa and other rheumatologists. Thank you so much. Take care, everyone.